Hi, I'm Tara Jones, and we're at a pharmacy that has purchased refrigerated pharmaceuticals from Cardinal Health to introduce how to prepare a refrigerated product for return. Cardinal Health recently made a significant change in the way we package and ship refrigerated pharmaceuticals to our customers. The purpose of these changes was to improve the integrity of refrigerated products being delivered through the use of tested and performance-qualified packaging that maintains your product between 36 and 46 degrees Fahrenheit. We need your help using these new phase change panels in the insulated totes to maintain uncompromised supply chain integrity.
To introduce you to these new materials and packaging, we prepared a video titled Introduction to Refrigerated Packaging, which covers why Cardinal Health made these changes and what to expect. If you've not seen this video, it may be helpful to take a few minutes to watch this to get a better understanding of these changes.
The first change in preparation for a return is that the green panels must be placed into a freezer for 24 hours or until frozen solid. The orange panels must be refrigerated for 24 hours prior to packaging your return. These panels have a label to let you know where to place them. This ensures that the product will remain at the correct temperature until it arrives back at Cardinal Health. Please keep enough green panels in your freezer and orange panels in your refrigerator to prepare for a typical size return. We kindly ask that you return all other panels in the insulated totes that you send back to Cardinal Health on a routine basis. You receive your refrigerated pharmaceuticals from Cardinal Health in small or large totes. The small totes are approximately 7 inches tall and about 4 inches deep. The large totes are approximately 13 inches tall and about 8 inches deep. The small totes come with 1 orange and 1 green panel, and the large totes come with 2 orange and 2 green panels. Now, let's prepare a return of refrigerated pharmaceuticals. First, let's identify the size tote that you have. Remember, the small totes are approximately 7 inches tall and the large totes are approximately 13 inches tall. If you have a small tote, you will need to get 1 green panel from the freezer and 1 orange panel from the refrigerator. The green panel should be frozen solid and the orange panel should be cool, like any other liquid that is removed from a refrigerator. First, place the product in a plastic bag to protect the product from any condensation, and then place the product in the bottom of the small tote. Now, place the refrigerated orange panel directly on top of the product and place the frozen green panel on top of the orange panel. Replace the foam lid and then close the tote lid. If you have a large tote, you will need to get 2 green panels from the freezer and 2 orange panels from the refrigerator. The green panels should be frozen solid and the orange panels should be cool, like any other liquid that is removed from a refrigerator. Place 1 frozen green panel in the bottom of the tote and then place 1 refrigerated orange panel on top of the green panel. Now place the product in a plastic bag to protect the product from any condensation, and then place the product directly on top of the orange panel. Now place a refrigerated orange panel on top of the product and place the frozen green panel on top. Replace the foam lid and close the tote lid. In the event that there is empty space in the top of the tote after loading the product and the panels, place wadded paper dunnage or other non-toxic filler to prevent damage from shifting of the panels and the product. The panels are not only labeled to indicate that they should be conditioned in a freezer or refrigerator, but they are also labeled to indicate that the orange panels must be placed directly against the product and the green panels must be placed farthest away from the product. In the event that the labels are missing, think of green as the colder color and place them to the outside and place the warmer orange colors against the product. Another way to think about where to place the orange panel is that the refrigerated orange panels should feel approximately the same temperature as the refrigerated product that you have removed from the refrigerator to return. You will receive a Merchandise Return Authorization Form, or MRA, that must be completed and signed for all pharmaceutical returns. Additionally, there are specific instructions for refrigerated returns, along with an additional page with instructions and diagrams that cover what we have seen here today. Now, as a recap, let's watch the pharmacy pack a small insulated tote for return. Notice that the product was placed in the bottom and the refrigerated orange panel was placed on top of the product, and the frozen green panel was placed in last so that it was farthest away from the product. Now, let's watch the pharmacy pack a large insulated tote for return. In order to keep the refrigerated orange panels next to the product and the frozen green panels farthest away from the product, did you notice that one frozen green panel was placed in the bottom, followed by a refrigerated orange panel, the product, another refrigerated orange panel, and finally, the last frozen green panel? Remember, your product is refrigerated, so always place the orange refrigerated panels against the product and the frozen green panels farthest away from the product. Or think of it this way: green is the colder color, and cold goes to the outside, and orange is a warmer color and goes against the product to keep it from freezing. We know that this is a little more complicated and requires more steps than what you did before with the frozen gel packs. Cardinal Health is also taking these extra steps on every shipment we send to our customers. Let's work together knowing that these extra steps have one goal: ensuring the refrigerated pharmaceuticals that you provide to your customers have always been maintained at the labeled storage temperature from Cardinal Health to your pharmacy. And additionally, any returns back to Cardinal Health have been maintained as well to help ensure that safe and effective product is shipped to your pharmacy, as well as all the pharmacies that Cardinal Health serves.
As with all pharmaceutical returns, please remember to follow the instructions on the MRA to include the customer's signature, which must be completed to allow return of this product. We'll work patiently together to learn these new processes, knowing that will benefit the end users of our products, the patient, by ensuring uncompromised supply chain integrity.
As with all refrigerated pharmaceuticals, product that you intend to return must be placed in a refrigerated environment upon arrival at your location. In the event that you do not have an insulated tote and the required number of green and orange panels on hand when you need to make a return, please either wait for the next refrigerated order to arrive or contact your sales representative, customer service, or Cardinal Health Distribution Center management to send you the required materials with your next order. Please keep in mind that the panels must be conditioned in the refrigerator or freezer as appropriate before you can send them for return. Also, please prepare the return as close to the return pickup time as possible.
Cardinal Health and our customers have a common goal: to ensure patient safety that starts with uncompromised supply chain integrity.
I'm Tara Jones.
And I'm Chris Anderson.
For Cardinal Health, thanks for watching.